I'd like to talk to you about the long-term management of your pulmonary embolism.
Oh, I thought I'd nearly finished the treatment. I've been getting heparin every day through this drip and I feel much better now.
That's good to hear. What you've nearly finished is the initial treatment of the clot in your lung. The first step is to heparinize patients through the IV route to prevent more clots from forming. Patients have heparin through a drip for 5 days, then change to anticoagulant tablets.
Are the tablets what you mean by long-term management?
Yes. You'll need to take anticoagulant tablets for at least 3 months when you go home. I'm going to prescribe a tablet called warfarin.
I think I've heard of warfarin. It's called a blood thinner, isn't it?
Yes. A lot of people call it a blood thinner because it helps blood flow through the veins more easily. It's also less likely that your blood will form any more blood clots.
Okay.
There are a few things you need to know about warfarin. You'll take 1 dose per day with your evening meal or just afterwards. It's important to take every dose at around the same time each evening.
Right.
Remember that because you'll be taking an anticoagulant, you'll probably bleed more easily than normal. This means you may have nosebleeds and bleeding gums. You'll also bruise more easily than before.
Will that always happen?
It mostly happens in the first few weeks of treatment, but there are things that can make it more likely. For instance, you'll have to be careful with your diet.
What? I have to go on a diet?
No, nothing like that. You'll just need to be careful with foods that are high in vitamin K.
Oh, but I don't have any idea about those sorts of foods. How will I know what I shouldn't be eating?
Don't worry. You'll be given a leaflet on the foods which are high in vitamin K before you go home. The reason it's important to know this is because vitamin K helps to speed your blood's clotting rate, which is what we are trying to avoid by giving you anti-clotting medication.
Okay.
You'll also have to see your doctor for a regular blood test.
I thought I only needed blood tests when I was in hospital. It seems overcautious to me and a bit of a nuisance.
I know it may seem unnecessary, but it's important to check your INR or clotting rate to make sure that your warfarin dose is correct.
Oh, why wouldn't it be correct?
The dose may need to be adjusted, especially when you first start taking it. The INR gives your doctor an indication of which anticoagulant dose is effective for you. The doctor will increase or decrease the dose according to your blood test result. You may need a weekly blood test at first until your clotting rate reaches the correct level.
Okay, I understand now.
The last thing I wanted to talk about is your anticoagulant alert card. You should make sure that you always carry it with you.
What sort of card is that?
It's a card specifically for people who are on anticoagulant therapy. It's important to carry it with you at all times so that special care can be taken to make sure you don't hemorrhage after surgical or dental procedures or if you injure yourself.